Hello, and welcome to Think Fit, Be Fit podcast. My name is Jennifer Schwartz. I'm the hostess and creator of this podcast, where we are dedicated to effective thinking for potent exercise. This episode today is an interview with my personal doctor. She's a functional medicine doctor. Her name is Dr. Anca Sisu. She is located in Alexandria, Virginia, where my business is as well, Impact Your Fitness. And she has been part of my network for about a year. And she and I started the patient-doctor relationship not too long ago. And part of the setting for this episode is me learning about my body and being an elder millennial, trying to stay as healthy as possible. My goal might be like yours, in that I do not want to age the way my parents did. And I want to thrive now and decades from now. So, that's what I'm going through right now. I'm learning this stuff from an educated place, from an experienced place. However, this is it's a fun conversation. We focus a lot on, why functional medicine is a bit different from our conventional medicine, and that detailed medical testing for health and illness in any stage of life can be done through functional medicine. We talk about skin as a reflection of the gut health. We talk about leaky gut and muscle growth. We discuss my health goals, my resilience goals. We talk about genetic mutations and various manifestations of that in health. I thought this was pretty cool. That's at the end. And we also talk about telemedicine and functional medicine. So I learned a lot through using functional medicine in my own personal healthcare. I outlined the entire thing in an episode. It's over 40 minutes long. Please check that out. It is on the show notes and linked on the show notes. But, as you may have noticed, being healthy really drives my motivation. What keeps me coming back to this podcast with so much passion is knowing that we deserve more than what the fitness or most physical therapy businesses really offer us in terms of injury care, fitness care, and self-leading with fitness. I know that you're tired of this, but most of us are really tired of bland information from the fitness industry. Well, guess what? Dr. Google is also very terrible in this way. They, us being, kind of controlled in the media and through data through pharmaceutical companies and through big pharma has really changed the way conventional medicine works. And that's why functional medicine is something I bring up with pretty much all of my clients in Alexandria, Virginia. And just like my business, this podcast isn't for people who desire a status quo. We want a healthy lifestyle, we want an optimal lifestyle, and we want to ask the good questions of how to get there. Well, functional medicine is where it's at. They give you space to learn about you, learn about your history, your unique body, your questions around your health, and that there's so many environmental factors involved. There's so many emotional factors involved. And I'm such an advocate for this type of medicine. So that's why we're here today. And I really hope you enjoy this episode with Dr. Anca Sisu. She is in Alexandria, Virginia. You can see her and all of her accreditations at restorebalance.net. And you can reach her there and request a consultation or a virtual appointment, or if you're in Alexandria, a in-person clinic appointment. Before we head into this interview, please go check out thinkfitbefitpodcast.com, where you will find our brand new website and join our mailing list that has all kinds of cool guides and videos on how to get deeper with your exercise, how to connect better, and how to be a thinker and an independent thinker about your fitness and your body. This is so aligned with that, you guys. I really hope you enjoy this episode. If you'd like, you can meet with me on Instagram at impact_your_fitness on Instagram, and thinkfitbefit_podcast on Facebook and Instagram. Enjoy. Potent exercise comes from a healthy body, and that means, in my definition of health, which we are definitely going to dive into, the full body health, not going by the measurements and the standards of the standard American diet or the standard American acceptable levels of health. And that guest is Dr. Anca Sisu. She's a functional medicine, a functional MD. So you're a functional medical doctor, correct?
Correct, yes.
Can you please tell us the rest of your professional affiliations and accreditations and stuff?
Sure. Hi, Jennifer. I'm so pleased to be with you today. And so I'm a regular medical doctor. I went through conventional family medicine practice training, but I've been always passionate about integrative holistic medicine. So I got trained in acupuncture, osteopathy, and then I pursued the training through Institute of Functional Medicine because I wanted to help more people than I was able to with the conventional medicine skills that I had. So I take a whole body approach to people's health, and with an important emphasis on nutrition, gut health, balancing hormones. In general, my goal is to bring people back in balance using this holistic approach and find the root cause of their medical issues. And once we find that, then we reverse it. People start feeling so much better and they don't need the doctor as much.
So your practice is called Restore Balance, correct?
Yes.
Okay, so balance is it's one of your missions, probably.
It is my mission to balance both the physical, emotional, and spiritual body because people get sick when they're out of balance. So that's kind of my goal and mission. And I do osteopathic medicine, which balances a lot the physical body. Acupuncture balances more the emotional body. And then the nutrition and functional medicine kind of balances the whole person.
Nice. I'm just excited to have you on my team as as a person who loves their health and loves their body. So this is just so exciting. And one of the things I really wanted to get started with, because I think this question will show the difference between what we know as an internal medicine practitioner versus a functional MD. So, and these are questions that I've been asking myself. I've been on a very spiritual junkie path as of the last year. So there's a lot of journaling and a lot of meditation, and one of the hobbies I picked up in quarantine has been astrology. Okay, so I just love it. So one of the prompts I thought of is, what for me, what does it mean to be thriving? What does it mean in the physical sense, our physical health? What does that, how do we experience a thriving and resilient body, health, and energy? And so when I asked myself that question, I simply said, feeling security within and inspiring others to do the same. That, I'm consciously making positive and productive choices towards alchemizing the spiritual feelings and pain, but also making consciously making positive and productive choices for my body. What is your perception of thriving and resiliency in the body?
That's a great question. I see a lot of people who come in because they are feeling tired or they are just not feeling at their best. And it's like detective work for me to discover why that is, what's the missing piece there. And so, for some people, it is not having enough energy in the morning to get up and do the things they're supposed to do. For other people is not having the endurance to exercise or to finish their day. They might be feeling great in the morning, but then kind of sluggish in the afternoon. For other people is more of not having the drive or feeling depressed or just feeling blah. So with those components, I look at digestion and absorption of different nutrients, because this is essential to rebuild your cells in your body and to manufacture energy. And the gut is kind of the fundamental part of the body, because this is how the different nutrients get absorbed, different hormones are manufactured, and also the inflammation can sometimes reside or start in the gut. And so if you're just inflamed, you might feel achy, and when you're feeling achy, you're not able to exercise as much, or if you're not absorbing certain nutrients, you might not be making the hormones that are optimal for your health. And so taking a deeper look at the gut through functional medicine lenses gives me some clues into what's happening with all those components. And then I talk to people a lot about their sleep. Gotta sleep, 7 to 8 hours at night, the restful sleep, which a lot of people don't do or don't have time for sleep. And then, it's about doing your exercises, on a daily basis, having some purpose in your life, living with joy, finding some passions that you have and connecting with those things. And all these things could be missing pieces, and we don't have time to do everything, but we have to find time to do the things that balance our body.
You hit on a couple really interesting points here that I think will highlight why functional medicine is so special. And essentially, it's almost like an anti-capitalist model of medicine, in my opinion. But stop me if I ever make these jumps, because I'm a philosopher in my head. I just want to connect all these big ideas, and so I'm happy to back off sometimes. But one of those things is you said some of the people that come and see you are feeling just lack of energy, and I know that your continuum of patients goes further down the sick line of probably cancer, IBS, all the high inflammatory diseases, right? But you said feeling blah, lack of energy, don't have the energy to finish the day, right? Most people think that's normal, right?
That's what they think, but it is not normal.
Yeah. Yeah. So, do you so at that point, do you use testing to reveal that it's not normal, or do you take a very proactive educational approach to that?
Good question. I like to test because I like data, and if you don't test, you don't know exactly what's going on. So with functional medicine, we have access to more detailed thorough testing. I was mentioning the gut assessment. I use a comprehensive stool test, which looks at how you're breaking down your foods, the gut microbiome, balance or imbalance, if you have certain infections, if you have a lot of inflammation, if you have a leaky gut. So by just doing this test, we have a bunch of information that's very actionable. And based on it, I make recommendations to my patients to treat the condition they have. I've had patients who didn't want to be tested, so we took more of a broad approach, and that can work, but again, it can take longer, and it's not as specific. In today's busy society, people want to get better yesterday. So in order to do that, I think testing is very important to give us the data.
Yeah. So that's interesting. You can get information about inflammation from a stool test.
Yes.
Is that what you said? Okay. So that's my next, you said inflammation starts in the gut. Did I write that down correctly?
It can start in the gut, yes. Yeah. So there is a number of imbalances that can create inflammation in the gut and then throughout the body. And, we can detect that with the stool test, we can detect that with blood work, and, take the corrective steps to manage that. And, a lot of people have joint pains, for example, or achiness in the muscles and in the body. And then for that, I sometimes do a food sensitivity testing, which reveals a number of foods that people are sensitive to, and oftentimes starts with disrupted gut.
One of my goals, one of my resiliency goals is optimizing protein synthesis, because I love working out, and I believe not that I just love working out. I think bone health, brain health, and muscular health, oh gosh, I could go down the whole list, all have a very strong and intimate relationship with building muscle, and so if we talk about the building muscle process and the gut, what would you look for? Not maybe what would you look for? Yeah. Where would you go with that as far as testing or the looking at the stool results?
So there is a marker for the leaky gut that I look at with this stool test. And, if the gut lining is disrupted, that tells me that people don't absorb the nutrients very well, or certain proteins that should not be, absorbed, like bigger molecules, pass through and they create a reaction to the body. So, that is one of the tests. So the integrity of the gut lining is important for absorption of the different nutrients, including proteins. And, there is the gut microbiome. If that is disturbed or disrupted, there are certain vitamins that take place in a healthy microbiome. So I oftentimes see deficiencies of B and K vitamins if the microbiome is imbalanced. And, the metabolism is like a perfect orchestra there. And if you have certain missing pieces, it's kind of the building blocks that are missing from the production of your hormones, from the building of the muscles. And so, interestingly enough, there's a protein, an amino acid, actually glutamine, that I use quite a bit to repair the gut lining. And that is also used for, building muscle endurance. And so this is an important amino acid to help heal a leaky gut.
Yeah. Okay. Yeah. So muscle building and gut lining go hand in hand.
Yes.
And when I first heard of leaky gut, I just assumed it was leaky in a consistency, that the word leaky was describing the consistency of stool. I hadn't realized that it was the permeability of the actual lining, which is it seems like this. So that is where we absorb nutrients, it sounds
Exactly.
like.
Exactly.
Okay.
So the gut lining is just one line of cells that should be very tightly connected. And so when you lose that connection, that is what they call a leaky gut. So it's a disturbance in the barrier, in the junctions that are supposed to keep everything tight inside of the gut lumen. But in turn, it opens up and allows kind of different things to come in. And people with autoimmune diseases experience this quite a bit, a leaky gut.
Yeah, that's where I was going next. So if I picture, I love metaphors and analogies. So if I picture this like tree, and at the base of the tree is like a leaky gut. What are the branches going to end up being? Like, how many inflammatory or how many chronic illnesses could start with leaky gut?
That's a great question. It's a number of them. I have people who have joint pains, people who have autoimmune conditions, headaches, skin issues. And the list can go on and on. It's kind of the starting point of a lot of chronic conditions.
Geez. So if you could educate people on leaky gut, I think you should give it a different name.
Yeah, it's it's also known as increased permeability of the gut lining, and the process can sometimes start with overuse of antibiotics, or eating the foods that have been sprayed with a number of pesticides that actually open up those junctions in the gut. A lot of the inflammatory processed foods. Sometimes people get an infection, a bacterial or a parasitic infection, which is the starting point of this leaky gut. And the body does an amazing job to try to heal it up to some point, but there is an ongoing number of insults that continue to happen. So, for example, you took an antibiotic for 7 days, then you started eating your standard American diet, which inflames the gut lining even more and more. Then you might just get in, eat a raw hamburger that has a parasite in it, and that also affects the gut lining. You eat too much sugar, and that's just adding to the insult. So it's an ongoing process, like a vicious cycle that we have to stop.
Geez, yeah. So in my practice, I call that the allostatic load.
Yes.
Because people come to me for chronic injuries, and usually they're pretty active. So on the surface level, they look healthy. They quote unquote look healthy. They are moving. They are moving every day, but there's something there's a load that they're carrying around that is holding them back. And I didn't make that term up, right? That the allostatic load is a way to describe how flexible your system is at getting to homeostasis, like getting to your most efficient way. So in exercise, an exercise is an excursion away from homeostasis, right? Like exercise is a purposeful activity to go away from homeostasis, your baseline, and challenge your muscle, challenge your nervous system and your immune system and all the systems to retreat back to homeostasis. And so if there's a high load, an allostatic load, and I'm not explaining this to you, I think you understand this, but for the listeners, just an insight to my practice, when you go into that excursion and you can't return and your body doesn't recover, that is a problem. And that's the context that I talk to people about it. But this goes into basically the day-to-day stress of our modern society that our body hasn't completely evolved to or has poorly adapted to. Shoot. Do you have any comments on that?
Yeah. So in today's society where everybody is stressed, what I find that is that people's hormones are out of balance, and they're thinking about the cortisol. People are a lot in fight or flight response, and during that state, the body cannot really repair. So then when you start adding exercise to a very stressed body, that sometimes can make you even more stressed. And so you're getting into vicious cycles of, oh, I'm exercising, I'm doing the best I can, I'm eating a decent diet, but still I cannot lose weight, and I'm more and more stressed. So, this is the what you're saying, that allostatic load, the total body load of, toxins, inflammation, that, you're thinking you're doing a great job with, exercising and eating decent. However, the body's, it has a load of either toxins or stressors or this leaky gut picture that we're talking about. And instead of easily recovering back to baseline, it stays in a chronic state of fight or flight. So that is another type of intervention that people can take, and working on stress and things like meditation, or slowing down actually on their exercise, doing more yoga versus high intensity exercises, just to get their body to unwind a little bit, will allow them then to restart their exercise routines and to be able to lose weight. But we really have to balance the nervous system during those situations.
Yeah. I mean, I've moved into suggesting people just get out and work out in the outdoors, in nature. And the more that I learn about how just being outside, doing healthy activities, not like the standard American diet barbecue version, and just that alone is just like such a chemical and like hormonal rebound for your body. It's just like, I mean, for like our modern problems, right? Like this flight or flight thing, like it just, then I don't know. This is kind of a new discovery for me as a gym rat. Before I ask my next question, I'm going to say, listeners, just a reminder that we do have a disclaimer on the show. This is not medical advice, but I'm going to start asking some more specific questions, mostly pertaining to me. So back to the gym rat idea. So currently we're in, what month is it from when COVID had started changing our whole society. I don't know, 4 months, 5 months. Okay. So, I tried to go back to the gym, and meaning like the weight machines, the squat rack and all that stuff. And I missed it. So I go back, I only go back 3 times. And while it was very like clean, secure, I felt safe there in one way, there was a whole nother layer of this stuff that like made me feel really uncomfortable, which was kind of like the energy exchange of just being there and like having to be hyper vigilant about who's around me. That's number one. Number two, I'm really concerned about these chemicals getting absorbed into my skin, which, and looking at the panel of blood that you just ordered, and that we're looking at the thyroid, am I justified in feeling worried about chemicals harming my body, maybe even specifically the thyroid?
Yes. So definitely the thyroid is one of the organs that is affected by toxicity around us. And so, certain people are more sensitive than others to chemicals. And I'm thinking more of people who have some difficulty detoxifying from those chemicals. But in general, we live in kind of a toxic soup around us, where from the air we breathe, from the food we're eating, the water, we are facing chemicals on a daily basis that our body has to get rid of. And so, I think in this situation that you're describing, knowledge is power. Knowing what kind of chemicals do you use to disinfect the machines, do you allow enough time for those things to off gas, so I'm not breathing in all these chemicals, kind of timing your exercise routine. So if they do the heavy cleaning in the morning, then don't go in there right after. And you're bringing up an interesting idea, which I was thinking about, is, if you're supposed to relax when you exercise.
Yes.
If you're in, hypervigilant in this high alert situation, the body's just going to get more and more stressed. So, I think it's important for us to get the information, what kind of cleaners do you use? Do I feel comfortable going in there? And so, create that space that feels comfortable. If that's not necessarily at the gym, then do it at home. But the purpose of it is to allow your nervous system to relax as you're, doing your exercise and feeling good about what you're doing. You don't live in fear, because fear is just going to bring on more stress.
Yeah. I mean, the optimal state to work out in is the flow state. Mm-hmm. So we have a little bit of a challenge, not too much risk, right? Like the challenge of novel stimulus, but not too much novelty, right? So that's why, again, nature is like the perfect solution. So I've been talking myself into like having an outdoor gym at this point. But I just can't, there's no other solution, and that equates to achieving the flow state. And so I think, for me, I've just been so vigilant about my skin and toxicity for a while. My first eye-opening experience. Okay, so let me back up. So based on that, I'm not going back to the gym right now.
Okay.
I bought a few extra pieces of equipment. I'm so spoiled, though, to be honest. I have a gym in my building that is completely acceptable. And I also have my own studio with Pilates equipment.
Awesome.
And I have a patio out at my apartment that I use the kettlebell, and I'll go do kettlebell. And then there's a place down the street that has these strength classes that I'm going to do once a week. And it's like, you just stay at your station and you still get like some group camaraderie. Cause like, as you can tell, as you know me, like I'm very, very extroverted. So like I gotta have some kind of interactions. So that's the new plan going forward. And I'm sorry if I triggered anybody. I'm totally spoiled in this. Like, I don't know. I'm very grateful and fortunate that my life has not completely been thrown upside down by this pandemic and all these society changing trips that we're all on right now, like going in circles and whatnot. So that's that. So my skin story is when I first engaged with the functional medicine doctor, one of his first prescriptions to me was a topical magnesium. And this topical magnesium had such an impact on my sleep that I could tell right away. There's very few supplements that you can say, oh, I know this helped me right away. That's the feedback and just general collective that I can gather. So once that started, once I was plugged into, oh my gosh, I'm putting this on my skin and it's impacting half of my day, basically every single day, and my brain health and my anxiety, I changed my whole entire perspective on the skin. And I also have done, the listeners are used to me telling this story at this, they might be. I've done a couple cadaver dissections. And for me, that is like, it was like spiritual. Like I'm forever indebted to those specimens, because it is so incredible to see inside the human body. And going through the skin and seeing the different types of fat, and seeing, you could almost see the toxic load in the skin, dude. Like I was blown away that you could see what fat looks like. And, so there was that, but then like just seeing like how thin it actually is. And it is a barrier, of course. And we just assume it's like this, like really strong barrier. It's just amazing. So like those two perspectives jumbled into this part of my brain that's like never going to let go of that, has totally, a long story short, my perspective on skin and skincare and the barrier of toxicity. Am I too vigilant? Am I losing it a little bit? Should I have a little bit more confidence in my body here? Or am I properly aware,
So I think the question could be asked in different ways. So from my perspective, the skin is our biggest barrier, but also our biggest organ of detoxification. So from that perspective, I find that the skin is a good reflection of your gut health, because part of gut health is this process of removing toxins from the body, and you can do it through, stool, through urine, but also through sweating through the skin. And what you're bringing up, the point that the fat that is placed underneath the skin has an important role to hold on to toxins or to free up some toxins that, oftentimes when we're exposed to pesticides, they end up in depositing in our fat. So, for people who have a lot of, skin issues, such as acne or rosacea, I do some thorough gut testing, and we find a lot of imbalances in there, ranging from inability to detox to certain infections to, there's a condition called SIBO, or small intestinal bowel overgrowth, that manifests with a lot of gas and bloating. And that's actually an imbalance in the gut bacteria. And that oftentimes manifests with skin issues. So, and then there is the perspective of what do we put on our skin? If we put chemicals that, increase the total body load of toxins, then in the long run, we're doing more harm than good, because then the body has a harder time removing those toxins. So, my approach has been to take a step back to say, how do I unburden the body from all this toxic load? And so, making sure that we're digesting and absorbing our foods, that we have plenty of fiber in our diet, and eat, clean and organic as much as possible. So being mindful of, certain foods that are more sprayed with chemicals than others. There is a list called Dirty Dozen and Clean 15 that people can look at to determine which foods do you absolutely have to have organic in your diet. And then, Environmental Working Group puts out lists of also different creams and household, cleaners that are less loaded with those chemicals and pesticides, because at the end of the day, it is the total body load that drives this toxicity. And if you have certain genetic mutations that don't allow you to detoxify properly, you're just holding on to those toxins, and they just manifest in different areas of your body, including the brain. Sometimes people have brain fog or just the fatigue they cannot break. And so, it kind of comes full circle if you're looking at the whole person.
Yeah. Yeah. Oh God, I could go in so many directions right now. My brain is buzzing. And okay, so when we talk about, what was that one thing you just said? Well, I'm curious about your skincare, and do you take that from like a gut approach? Because you guys might not be able to see her. We're taking some video, but I have no idea how old you are by looking at you. Like your skin is just beautiful. And that might be genetic, big component there. Oh, that's what I was going to ask. So I'd love to know a little bit more about your self-care routine, if you're comfortable with that. And then you said some genetic groundwork that people might have that might make them less able to detoxify. So I know those are like two probably big questions, but those are just the things that popped up in my mind. So
okay,
please.
I'll try to answer that. So, I realized how important the diet is, especially for my body, because, I cannot afford to eat bad a few days in a row. Otherwise, I'll be having issues, with my skin, with my joints. And so, I basically took this functional medicine approach on myself. And, when I first moved to United States from Romania, I was having a lot of fatigue and skin issues. And, going to conventional doctors, I wasn't able to get any answers. And so I was working with a naturopathic doctor at that time, who kind of started me on this path of, doing a stool test, finding out the imbalances in my digestive tract. I realized that gluten was a big issue for me. So when I removed gluten from my diet, my skin cleared up, my joints felt so much better. And so, I realized I had a number of food sensitivities, and interestingly enough, other foods that I really loved, such as tomatoes and cheese, were also triggers for both my skin and my joints and my fatigue. So I learned to, live without those foods, and I only have them occasionally, and sometimes I pay the price. But I also learned what I was just talking about, this detoxification issues that can start from some genes. So we have a pool of genes that come from our mother and father, and so when they combine, they can create some genetic variations. And so if they don't combine properly, then you can have some genetic glitches. And so, I learned that I had one of those mutations called MTHFR.
Oh, bless your heart. That's a hard one.
It is a big word. Yeah. But what that does is does not allow me to properly detoxify. So then I have to be extra careful to eat clean, to not to put too many toxins in my body, and to take certain supplements that balance those genetics. So this is my kind of long answer to your question. I think the skin is also a very good reflection of the gut, but also how you're sleeping, how relaxed you are, and what nutrients might be missing from your body. And so I think the skin, that my complexion is kind of how I was born with, but I was also adding all these layers to for general health. I wasn't necessarily targeting my skin, but as a side effect, my skin looks pretty decent.
Yeah, no, for sure. Because that's it seems like it would be a good indicator for us, because it's got like the whole like the survival of the fittest, like aspect to it. Like that should be like a huge alarm system that something is wrong inside.
Right.
Just from that, like it's a basic human sign of, quote unquote fitness, right? Like, right. It's going to make people more attractive. Anyways, so That's cool. What is I've heard histamine used as a component of like a genetic marker that might make someone more like overreactive or their inflammation load a bit higher. Is that true, or did I just like make that up?
Well, some people are more sensitive to certain foods that raise their level of histamine. But, we find oftentimes that if we look at the gut, there are some disruptions in the gut that kind of feed that pathway. So in this balancing process, certain genes don't manifest if you don't have the right environment for them to manifest. And so this is kind of my goal working with patients, is to create the right garden in their digestive tract, because when you disrupt this ecosystem that is your gut flora, then you start manifesting different genetic imbalances, and so when you have more inflammation in the body, you manifest those genes. So it's an interesting concept to say, okay, you can take a number of people who have the same genetic mutations and to see that actually the manifestations in their life can be so different depending on their lifestyle and their choices.
Yeah, I almost want to rebrand functional medicine as like, we start with the gut, like it's just that's what I keep hearing, which is so cool. So to wrap this up, I've got 2 questions. Do you have any exciting, like, continuing education that you're doing in the next 2 years, or something that you're working on that is exciting to you, like on a professional or maybe, personal or spiritual? And then the other thing is, I would love to know do you take patients solely virtual as well now? And like, how much has your practice changed since COVID?
Okay. So my goal for the next number of months is to be able to provide more of a more unified approach to different health issues. And so combining different modalities in my practice, such as the acupuncture and osteopathy, as they pertain to musculoskeletal conditions, but also to the gut health. So creating some programs that offer different modalities to treat certain conditions, because what I find is that if we only work on the physical level, we might not get as far as if we're addressing all the components, having people work on their stress level, which they can do by themselves, but it's more powerful to do it with the guidance of either a counselor or I work with people more like a health coach, where I keep them accountable every month to be sure that they are making the changes that we're discussing, because things get in the way. So then my goal is to see people progressing much faster through their health journey. And it is a partnership. It's the commitment that I make to them to hold them accountable, but also for them to make the changes, and when they are stuck, to reach back to me or to the nutritionist I work with to get them unstuck. And it's not just this theme. I know physical therapists that work both on a physical and emotional level that I'll be partnering with. Actually, in the space I'm at right now, it's also a physical therapy office, and they are fantastic. So it's more of this team approach that I'm working on for this next year. And then in terms of your second question was about pivoting to more online. I actually enjoy quite a bit doing, telemedicine consults, because I talk to people in their home, and they can show me, their supplements, and they can show me their fridge, and so I can see what they're eating, and how they're home looks like, or their workspace, because oftentimes, I ask them about, posture and their ergonomics at their home office nowadays. And so that's making things easier, and, it's saving time both for me and them. And so I find that, doing functional medicine is pretty easy to do online. People still see me for the manual therapies, and for the first time appointment, sometimes, not always, but I was able to pivot quite easily to the telemedicine, and I'm planning to continue doing this, because we're going to need flexibility for to work remotely, I think, in the next number of months.
Yeah. What do you think we missed anything that we should have brought up to, like, help the topics that we covered, be more, I don't know, understandable or relatable?
Yeah, that's, I think in the big scheme of things, people need to feel empowered, that if they feel like something is off in their bodies, they need to bring it up to a physician who has a different set of skills, who can, listen to them and work with them to dig deeper into what are their health issues. Because, sometimes it can be just a question of, I'm not feeling well, but I'm not quite sure what's going on. So it is the job of a physician to figure that out together with them, and to sometimes involve a team to help them out. And so, I would like, people who listen to really feel empowered to say, okay, I'm going to try to do my best, balancing my life, eating well, exercising, sleeping well. But if I'm not feeling good, I'm not just going to wait until these issues are so significant that I can barely get out of bed or I can barely function. I need to be proactive and preventative with my health, because, it's the best thing we have. If you don't have your health, then, you cannot work well. You cannot be there for others. You cannot be there for your family.
Yeah. I mean, I got a pretty intense physical manifestation of that when I was 20 years old. My mother died of Lou Gehrig's disease, and there's nothing more physically terrifying, except I did see, I can top that. But it was, it's like man-made, it's like the radium experiments of, the 40s, like, where people were being sold to, like, rinse their mouth with radium to look hot. And, like, then they ended up with, like, their teeth falling out. But again, that physical manifestation of losing your freedom, losing your life, doesn't always happen to us in a way that we can learn from it and go upstream, right? Like, that's the profound mission that I've put myself on, is to be upstream with my health and make it an asset for my life. And yeah, so as many times as I have to say that to get that into people's head, I will do it. Because, I just want to, like, mirror what you just said. Like, that's retweet. Like, that was great. I just thank you so much for participating in this and being so open, and also for, being available to me as a, on my team and as a provider. I'm definitely looking forward to diving deeper into my own chemical makeup, disruptions and makeup, and maybe even celebrate some resiliency, right? And because, like, the resiliency factor came up for me when I have to take this stool test. And I was like, oh my God, I have to go off my digestive enzymes. And, like, for like a half a day, you could, like, I was convinced, like, that was going to be, like, I was going to fall apart. But I've been off of it almost a week and I have not fallen apart. So that's just like wonderful.
It's trusting your body that it's going to know what to do, right?
Yes. Yeah. And that's like, that's for me, as someone who has gone through, I would even say a little bit of an eating disorder related to healthy eating. Like I can overdo it, in a way, like, and that has more to do with, perception than actually being ill, like mentally ill or whatever category of illness eating disorders are in. Excuse my ignorance. And like, yeah, so I don't know. So that I'm learning about resiliency in the most graceful way I can, even though, like, I'm a very aggressive and, and I just want to like attack it. So do you have any closing advice for me there?
Yeah, I think I admire the fact that you didn't stop at the point of, oh, I actually look good. And, you realize there are some things that might be off in my body. And even if the previous blood work looked normal when it was, done by your regular doctor, you did not stop there. You continue to see, okay, there is something that I need to figure out. And so I'm just going to find the right person to help me out. And so, I invite your listeners to do the same. Functional medicine doctors have this kind of broader training. And so Institute of Functional Medicine is the place, ifm.org, to find a practitioner near you to partner with and, find the holistic practice that is going to be there to help you balance your health. And so, I'm taking patients in my office, mostly from Virginia, but, people can see me through telemedicine or in person. And I'm grateful to be of service.
Yeah. Yeah. I felt really comfortable during our telemedicine visit, just for what it's worth for the people out there, because I've had mixed, feelings with it as like a, muscular skeletal care provider for people. And some people were like, no way, like, am I doing that? But like the people that have been willing to do this telemedicine type of visit have really benefit from it. And like, I personally thought ours was very effective and I felt totally comfortable, even more comfortable than I'd say in an actual office setting. So yeah. So I think that's it. That was a great episode. Thank you so much.
Thank you. I had fun.
Good. All right. Wow, that was a really fun conversation. I've really gotten to get to know her and feel truly grateful to have someone like her in my corner checking my blood work. So, thank you for hanging out with us this long. I would love it if you could join the conversation. You can connect with us on Facebook and Instagram, ThinkFitBeFit_podcast. You can tag ThinkFitBeFit with your extraordinary story and how you are embodying Think Fit Be Fit. Or if you have a topic or question, you can bring it up there and direct message us. Please subscribe to the newsletter on thinkfitbefitpodcast.com. Dive deeper with us. That's why you want to sign up. We offer a unique view on muscles, portals to new ways to respect the body and health, and, self-leading with fitness. We think learning and enjoying the process are buzzy terms. We take this stuff seriously and want to take you, our listeners, on the journey with us and through us. We also have a course called Movement Pathways. This is for people who want to learn how to manage the body, your body, their body, and exercise with precision. So this is for people with old injuries that haven't gotten over the hump. You can check that out at movementpathways.com. You can also hang out with me on Instagram at impact_ @your_fitness on Instagram, on Twitter @JenImpact. And you can check out, what else? I think that's it. Thank you so much, you guys. I am so glad to help you reach that really optimal level of fitness and ask really good questions of your body on this journey. Have a wonderful week, and thank you so much.